Yes, greetings, my dear friends. I am Professor Eddy. I'm a professor of public health medicine. Today, we are going to be talking about prostate cancer. It's really a very big public health problem. And we're going to break it in bits. Firstly, we're going to talk about a little overview about prostate cancer and what it's doing now. And then we'll talk about the risk factors and then the symptoms. Prostate cancer, prostate is a gland that is a part of male reproductive system. Every man has a prostate. So this gland helps in production of semen, and cancer occurs in this gland when you have abnormal growth of cells within this gland. When we talk about, people mistake prostate cancer a lot with benign prostatic hyperplasia. They're different. And these are the common ones you operate on here. You operate on anywhere. So benign prostatic hyperplasia is just mere enlargement of the prostate, especially the median lobe, and it presents most commonly with urinary retention. Is different from prostate cancer. Prostate cancer is the deadly one. Benign prostatic hyperplasia, like the name said, is just benign. And then you find out that this cancer is the most common cancer in male in about 112 countries of the world. It's the most common cancer among male. And also in 48 countries of the world, this cancer is the highest cause of cancer deaths. Again, if you come down to sub-Saharan Africa, it's ravaging that place more. It's commoner in those places. You find out that 14% of cases that occur in sub-Saharan Africa is as a result of prostate cancer. And 12% of cancer deaths in sub-Saharan Africa, again, as a result of prostate cancer. So it's a big problem. This cancer occurs in 1 in every 8 men globally. But like I said, it's a lot more commoner among black men. The good news is that this cancer really is beginning to decline in developed countries. It's better because their screening system is better. They watch out for it. But still in sub-Saharan Africa and these middle and low-income countries, it's still a very big problem. So everybody has to wake up. So let's quickly go to the risk factors. What are the things that will predispose you to having this cancer? Generally, these risk factors are grouped as unmodifiable and modifiable risk factors. The unmodifiable risk factors are the factors you cannot do anything about. They are there. All you have to do is that you keep screening and then watch out for it. Your index of suspicion has to be higher if you have the unmodifiable risk factors. And these are familial tendencies, hereditary. You find out that people whose father, brother, or any relative has had this cancer, the person is more likely to get it. We found out that 5 to 10% of cases of this cancer occur in people whose relatives or parents who have familial leaning to this cancer. Again, age. This cancer is commoner between 45 to 70 years, although rarely, especially in the blacks, you can have this cancer occurring in somebody as young as 40 years. And rarely again, you can have it beyond 70 years. But people within this age group, 45 to 70, they have to watch out and then screen at least once a year, or at the worst, once in 2 years for this cancer. Then again, ethnicity and race. This cancer is commoner in blacks, a lot commoner in the black race. Then in his list, we find it list among Asians, followed by the white men, Caucasians. So again, the black race, they have to wake up a lot to screening. Even in America, you say ravaging the black Americans a lot more. Those are the unmodifiable risk factors. The modifiable risk factors are tobacco smoking. Honestly, this tobacco smoking is a big problem. It affects, it's a known cause of this prostate cancer, and it causes many other cancers, up to 13, types of other cancers are caused by tobacco smoking. So people are advised to quit smoking. Honestly, it's a lot easier not to smoke. The next modifiable risk factors, these are risk factors you can do something about, is alcohol consumption. Excessive alcohol consumption has been found to be a risk factor for prostate cancer. So my dear men, my men folk, reduce your alcohol consumption. Alcohol consumption really affects so many other parts of your body. Non-communicable diseases, alcohol, tobacco, they are implicated. Then the next one is unhealthy diet. Unhealthy diet, it's so important if you're aging to eat right. Unhealthy diet like excessive consumption of meat and fat, they are not good for your health. They also risk factor for prostate cancer. You concentrate more on diet rich in vegetable, fruit, whole grain diet. These are good for you. So the next modifiable risk factor is obesity. Obesity, people who are big have been found to have predisposition to developing prostate cancer. And you find out that this obesity is as a result really of what you eat and your inability to exercise and move yourself. You just stay one place and keep, in fact, somebody says digging your grave with your mouth. So obesity is a risk factor for prostate cancer. Again, risk factor for so many other diseases that we shall talk about later. I've talked about physical inactivity, staying in a place, you don't move. It's advised that you exercise. Generally we say 30 minutes in a day. That's about for at least 5 days in a week. That is recommended. It must not be strenuous exercise, but develop the habit of exercising gradually. It's so healthy. Aside from preventing prostate cancer, it prevents so many other problems. It makes you fitter. Start by gently, simple, brisk walking. Then you can, within your house, within your parlor, if you have a staircase, go up and down. Do something. Move your body. It's so healthy. Aside from prostate cancer, it helps you reduce obesity, even hypertension, and so many of these non-communicable diseases. So let's quickly talk about symptoms. Symptoms of prostate cancer. Symptoms are the things the patient you notice that is abnormal, that you think is a problem. Incidentally, we advise that you don't wait until you start getting symptoms before you raise alarm. In most cases, once you start getting symptoms, it's a bad story, So we advise that you don't get symptoms. But if you're going to get symptoms, the common symptoms you get is you start having difficulty in passing urine, You start having painful urination. You want to pass urine, you have pain. At times, you can't even pass urine. It's urinary retention, Then you start having blood in urine. These are all danger signs. When you want to urinate, you see blood, And at times, even when you make love, you want to ejaculate, the semen contains blood. All these are signs that all is not well with your prostate. There is hesitancy. You come out to urinate, the urine can't flow. You wait for some time before urine comes. All these ones are urinal symptoms. There is erectile dysfunction. You want to, make love, you can't have an erection, you can't have sustained erection. All these are all problems that things are not going well. You find out that you want to urinate, the urine is not flowing out well. Young people, young men, they can stay one place and fire urine across the gutter or anywhere. But you find out that urine, the stream is poor. It's not going out freely. Then terminal dribbling, after urinating, urine is still dropping. So many of them, you will have your shoes. Think the urine dropping on your shoes or your sandals, is signs that all is not well with your prostate. Finally, if you start having symptoms of persistent and low back pain, especially associated with the other symptoms we mentioned, that is problem. It points out to the fact that it's possible that this cancer has an affinity for bones. It's possible your pelvic bones around your waist, has been attacked badly. And once you get to that stage, my brother, it's not good news. It is advised that you do all you can to avoid getting to that stage. And you all do this by simple things. Screening, We, from the, Community Positive Health Attitude Initiative, we, the team, we love you. And I am sure your people, they love you so much too. So we encourage you to do all you can. And incidentally, you have so much to contribute to the world still. So do all you can to avoid being a victim of prostate cancer. It's really killing so much. It's killing doctors. It's killing everybody. It's unbelievable. And the simple thing you do is to screen. PSA. You know, we get to specific screening later when we talk about prevention. PSA, do it and you track it. So, and then you stay alive. Don't say it's not your portion. It can be anybody's portion, my brother. And that's one mistake we all do. Then prayer is so good. God has made it possible for us to pray and avert things. But please take the necessary steps. It can be your portion. Please screen and stay alive. Thank you so very much.